before I enter my client's room, I'm going to perform hand hygiene. I'm going to introduce myself to the client. So hi, my name is Celia. I'm going to be performing your Foley catheter for you today. Is that all right? Right, perfect. So I have gained consent from my client. I'm just going to check the wristband to ensure that it's the correct client and that there's no allergies. So there's no allergies, correct client. So now I'm going to raise the bed for my client. Right, so it's the appropriate height. My sterile field is at the appropriate height. I'm going to place my clean gloves on prior to touching my patient. Okay. All right, here we go. Okay. After I do this, I am going to place my client in dorsal recumbent position. And then following that, I will drape my client to ensure that they are warm and covered. Okay, so already in the bed. I'm going to start by putting my urinary drainage bag to the side. Now I will drape my client. The edge of the bed. And I'm going to place it like so. And now I'm just going to lift it up just so I have access to the area. From later. And I'm just going to make sure. And now I'm going to place my blue pad down. Ensure that the mess is here. And then prior to starting the procedure, I'm just going to attach the bag to the bed frame, not the rails. And I'm just going to set this forward. Place this here. Okay, so it is attached to the bed frame. Now I can open up my sterile field, but prior to doing that, I'm going to set up my garbage. And then I am going to place it back so I can work. Okay. I'm going to do hand hygiene. I'm going to put on blue gloves. And I'm going to have some extra tape so I can tape the tubing to my client's leg afterwards. Now I'm going to doff my gloves. I'm going to place them in the garbage. Now I'm going to open my sterile field. So I'm just going to grab the corners, pull away. I'm going to open my sterile dressing tray, holding away from me and out. I'm going to pull up and grab the vortex and rotate this. Not turn my back towards the sterile field. And then I'm going to remove my drinks. Now I'm going to open up this one. And now I'm going to square it off. And I'm going to remove my gloves. Alright, so I'm just going to put these 4 steps down and I'm going to... So now I'm going to do this. I'm going to grab my catheter. First, I'm going to place them. So I'm just going to insert the catheter here and make sure that's in place. It fell out of the plastic. I'm just going to move this one. Oh, let me go read this one. It's fine, don't worry. I'll start again. Okay. Okay, I need to open it the other way so it doesn't fall out again. So now I am going to banana peel it open. Ensure that I'm not touching the catheter. I'm going to grab this. I'm going to place it in the tray. Throw this in the garbage. And now, not turning my back to the sterile field, I'm going to put my hand hygiene again. And I'm going to I'm going to check my Benadine, ensure that it's the correct expired, it's not expired, and it's the correct solution. Because it has been opened before, I'm going to lip it. And then I'm going to pour it in my kit. Not turning my back to the sterile field. Performing hand hygiene once again. Okay. Now I'm going to grab my forceps. I'm going to not touch this area. These are now not sterile, so I'm going to throw them out. Not touching the outside, just the inside of it. Now I'm going to place my fingers on the inside.
You know, it is really nice of you to hold it, I have to say. Oh, it's really nice of you to hold the drink for me, I have to say. Okay. Take this. Alright, can I start time to 20 points? Okay. Okay, so I've come in the room, I have done hand hygiene, I've checked with the patient that they're alert and oriented and able to give consent, and they have. I've raised the bed to a working level.
Okay, so now my sterile gloves are on. I'm going to first open up this strip. The glossy side is going to be down. I'm going to flip it like this, and now I'm going to place it down.
I'm going to take the urinary drainage bag out, and I'm going to place it on the
And now I'm going to take my other blue pad out and place it down.
I'm going to put this here for now, the level where I can work, and I'm going to make this into a garbage. So that I can put stuff in there later. I'm then going to...
So now, I am going to first move my tray to my sterile field. And I am going to first grab the lubricant and pour it on the side prior to contaminating my hands. So now this is garbage. And now I am going to open up my specimen container just so I have everything prepared and ready to go. I am now going to attach my syringe to my catheter just so everything is prepared prior to contaminating my non-dominant hand.
I'm going to come back, and I'm going to ensure that they have a little bit of privacy there.
Right, perfect.
When it comes down to the procedure.
Right, so now I'm going to I'm going to clean using my dominant hand.
And then I'm going to rip my tape for later once I go to...
So I'm going to hold it open. I'm going to clean the inside with one swipe. Place it in the garbage.
So that when I put my blue pad
Another swipe on the inside and throw it in the garbage. Now I'm going to go on the outside. Throw it in the garbage. And on the other side, throw it in the garbage. So now, these can go in the garbage. Now I'm going to lubricate my catheter, which I have already preset.
I'm going to open my sterile tray.
And then I'm going to insert it
Like so.
right. Right, so urine has started coming out. That means I've known I've gone far enough. So I'm just going to push a little bit further. Right? So now I'm going to blow up the balloon.
So now we're going to take
All right. And then I'm going to collect a specimen. I'm going to detach it. And I'm going to collect a specimen. Okay.
And then I'm going to...
Now I'm going to detach the cap. And I'm going to attach it on.
What I'm going to do is I'm going to check the expiry date of my normal saline. I'm going to make sure that it hasn't been opened within the past 24 hours. And then I'm going to go ahead and put some into the garbage. And then
Now it is not a sterile procedure. It's no longer a sterile procedure. So I'm just going to remove this. I'm going to close my specimen container. I'm going to now tape the tubing to my client's leg
And then I am going to don my sterile gloves
to ensure that it is secure.
to make sure all the hand sanitizer is dry before I do
Now I am going to remove this. I'll place it in the garbage.
sterile gloves. And I'm going to put it
I'm going to cover up my patient. I'm going to place their legs back to normal position. Right, I am going to doff my gloves. Throw them in the garbage. And now I'm going to lower my bed. Ensure my client is comfortable, feels fine. I'm going to also take the drape off my client.
Yeah?
I'm going to perform hand hygiene before I leave the room. That's it.